Hi guys, today I will be talking about a new contraceptive method called Essure. What is Essure? Essure is the only non-surgical permanent birth control method available for women only. It is a fairly new concept. It was approved by the FDA for use in 2002. The procedure is irreversible and it doesn't affect the woman's hormone. Right here is the Essure. As you can see, it's fairly small and it's really flexible. It was made by copper titanium alloy. Essure mechanism of action involved placing two flexible inserts into the fallopian tubes. Over a period of about 3 months, the build of scar tissue around the inserts will create a barrier that keeps sperm from reaching the eggs. The entire procedure can be done under 1 hour without any anesthesia. Right here is the fallopian tube. Okay, now is the procedure in detail. First, the doctor will use a hysteroscope with camera and insert it through the vagina, into the cervix, and up to the uterus. Then, 2 pieces of ensures will be placed at the entrance of both of the fallopian tubes. As you can see from the picture on this side, it will go through the vagina and into the uterus. It will be inserted right here and right here. And on this side is the real life pictures of the actual procedure. And this is the Essure. And here is the entire Essure delivery system. This part right here. This part will go through the vagina. During the next 3 months, could be longer depending on the person, scar tissue will form around the micro insert, creating a natural blockade that sperm cannot pass through. So before the scar form, the patient must rely on another form of contraceptive method until the confirmation test is done. The Essure confirmation test is a procedure where the doctor introduces a special dye into the uterus. Then using X-ray, it can be verified that the Essure inserts have been correctly placed and the fluid cannot flow past them. This confirms that the tubes are completely blocked, and now you can rely on Essure as the sole form of birth control. So it will go through vagina and into this. The dye will be around here. It should not pass the tube. And this is the X-ray. As you can see, the 2 Essure and the dye cannot pass it. This is another one. Patient education. Essure system is fairly cheap. Pricing can go from around $500 to $2,500. The service is available over the counter and it can be done at any certified outpatient office, clinics, and hospital. Essure has 99% contraceptive effectiveness. It does not protect against HIV infection or any STI diseases. Also, the procedure should not be performed during the menstruation cycle to prevent the misplacement of the inserts. Advantages. Essure is fairly quick. It takes about 1 hour. It does not require any incision, no anesthesia, or any hormone therapy after. It has fairly fast recovery rate, which is just take 1 day. There is some controversy though. Both of the 1 year and 2 year failure rates established in Essure clinical trials were 0%, but a study was done through Yale which states that the failure rate is actually closer to 11%. And right now there are currently ongoing studies regarding this matter. Disadvantages. The procedure is permanent, so this could lead to regrets in the future. It is made from copper, so there could be an allergy reaction from this. Also, there are some reports of pain and discomfort around the pelvic region long after the procedure is done. And since this is not 100% chance of contraception, if the women do conceive after having their system in place, there is a higher chance that the pregnancy will be ectopic which means that fertilizations of sperm and egg happens outside of the uterus, and usually this will be around the fallopian, and this could be dangerous for the woman. In conclusion, this method only around over 10 years, so there are still ongoing about safety and side effects concerns, but since it has been approved by the FDA, this method is really effective and it should be considered by people who no longer want to have baby. And this is it for my presentation. Thank you.